So first off, can you just sort of explain what you referred to in your op-ed as the shadow curve?
Sure, happy to do so, Hannah. So the shadow curve, for me, really is a phrase that captures the idea that with COVID, we've been talking about flattening the COVID curve, which is perfectly appropriate. COVID's obviously a very serious infectious disease, but in the background, a shadow curve has been rising, and to me, that is all the diseases that are being disrupted and not treated while we've disrupted the American healthcare system. So cancer, certainly at the top of the list, but heart disease, neurologic issues. You can imagine that with hundreds of thousands or millions of those types of cases, it's almost like a tidal wave that's kind of building in the background. And so that's what I refer to as the shadow curve, is all of the other medical conditions outside of COVID that are deadly and that are rising in the background.
So, in speaking with some other doctors, I've kind of already been told that these rescheduled appointments have already become overwhelming to the system. What will happen if this continues for the long term?
Yeah, in the long term, Hannah, my personal goal is to prevent a study being written in the year 2023 where we look back and say, in 2020, we missed, 500,000 cancers and, 500,000 other, heart conditions and other things that have led to increased death and increased, worsening of the quality of life. So worse mortality and morbidity in the future. And to me, that could occur in a few ways. Number one, just the direct lack of screenings and diagnoses. It's been estimated already that potentially over 100,000 cancer cases have been missed, just from the direct aspect of missed screenings. But our American healthcare system, as you know, Hannah, is so fragmented as it is. Think about the average patient who had a doctor's appointment scheduled in April, had a mammogram scheduled in May. In a perfect world, you would say, okay, you know what, on June 1st or on July 1st, come back and get that done. Unfortunately, we know that our American healthcare system is horrible at continuity of care. And so what ends up happening is, the doctor's office ends up looking at that patient's record and say, oh, wow, you know what, they missed their mammogram last year, the year 2021. And so these things are going to get pushed out further and further. And then finally, of course, patients are disrupted with their lifestyle, or they don't want to go in. And so for direct screenings, for indirect sort of diagnosis of disease, and then just for general disruption due to patient preference or system preference, we're sadly missing a lot of diagnoses, and the resulting therapy will be, unfortunately, in a worse position.